Good morning. Today we're going to be talking about anthrax, which has been a lot in the news recently. Good morning, both Dr. Alero Roberts and Dr. Philip Oshun. It's lovely to have both of you here on the program.
Thank you.
So, Dr. Oshun, if we can start off with you as a specialist microbiologist, can you tell us what is anthrax and why is it that it's been in news so much recently?
Okay. Anthrax is a disease that affects animals like cows, goats, pigs, and it can be transmitted from animal to man. So we call that a zoonotic disease. It can cause life-threatening infections in animals, resulting in mortality. That means the animals can die, can be sick and die. And so there's been a recent outbreak in the last month, 5 to 6 weeks in Nigeria. And it started in the north central region of the country. So what is important about anthrax? It's caused by a bacterium. We call that bacterium Bacillus anthracis. So the bacterium usually found in contaminated soil, contaminated water, and they occur in what a form that we call spores. These are forms in which the organism or the bacterium hides and is able to live for a long time. So the animal would ingest or breathe in these spores and then get infected and become sick. And sometimes they may die. So one of the things to watch out for is animals like cows, like goats that become sick, or we find them bleeding from the nose, from the mouth, and usually this blood does not clot, so they keep on bleeding, and that would be a danger sign to watch out for in these animals. And so the disease can spread within the animals, and so that's why the animals that are sick needs to be taken away and quarantined. And of course, the workers, whether it's in the abattoir or whether it's the butchers or the cattle rearers, they need to get in touch with the veterinary authorities and the Ministry of Agriculture when they find us. Then why is it important for humans? Humans come in contact with these animals. The workers, those who kill animals in the abattoir, the butchers, those who cut it when they get to the market to sell, those who are cattle rearers, those who keep animals even at home. Those are people who come in contact with animals. And even the products from these animals, the hides and skin, wool from these animals can also carry these bacterium, this organism, and so can be spread from animals to human and cause infections in human beings also. And what are the type of
Yes, what kind of infections are caused? That's when people are now sitting up to hear. So what is caused in humans? Because recently there's been Ebola. They said it's zoonotic. They said COVID came from animals. So when people hear animal illness again, animals are dying all over the place. People are panicking. People are saying, "Is this another COVID coming for us? Is this another Ebola coming for us?" Where does it start? Where does it end? Can you tell us about the illness in humans when it affects us?
So thank you very much. So the first thing I would say is that we should not panic. In humans, the transmission of the disease starts with contact with a sick animal, whether we ingest it or touch or come in close contact with this sick animal. So there are three ways by which the disease can be transmitted, and that means there are three types of the disease in humans. So there are three different types of anthrax. The skin anthrax, that's what we call the cutaneous anthrax, is spread by contact with a broken skin. So if you have a sore or a cut on the skin and it come in close contact with the sick animal or the products, whether the meat or the hides and skin or wool from the animal, then can get infected. So that's the skin, that's the infection through the skin. So that's the skin anthrax. And it will present with blisters, with ulcers, with a black center. That's the way it presents. So that's the first one. The second one is the one that is transmitted by contaminated meat that we ingest. That means the meat that we eat. So we call that the gastrointestinal anthrax. That's like, for the layman, we can say the stomach or the abdominal anthrax. So that presents with abdominal pain, that presents with fever, diarrhea, watery stool, sometimes even bloody stool. So that is the one for the abdomen or the stomach. Then the last one is the one that affects the lungs. We call that inhalational anthrax, usually when there's release of spores, especially those who come in contact with the animal that is sick and try to kill the animal, and the blood spills, and so the spores can be released and inhaled, and that leads to cough, difficulty with breathing, loss of breath, then patient becomes sick and then develops a lung disease. So those are the three ways in which the disease can be transmitted from animals to humans. And those are the symptoms that we mentioned that the humans will look out for when they're in contact with sick animals.
Okay, now thank you very much for that. And Dr. Alero, thank you. Your favorite public health physician. He said a lot, and I think there's a lot to sort of allay our fears. But people have sort of been watching the anthrax as it has moved across West Africa. It started somewhere else, went here, went there. They said, oh, it's only a matter of time before it comes to Nigeria. Now it's here in Nigeria. It started in the North Central. Has it come down to Lagos? Is this something we're all supposed to be, looking out for even here? What is the position in terms of our public health, and how should we respond to it?
These are the issues for me with these are the public health implications, as it were, of anthrax. Now we must remember that this is a disease. The agent that causes anthrax, the Bacillus anthracis, the spores are highly infective. Okay, which means that the biggest danger is that animal to human contact can very quickly lead to the most. In fact, 95% of cases are the inhalational anthrax, the one that gets into the lungs from breathing in the spores. And it has a high fatality rate. So bottom line is that this is a disease that can cause death. Two, because it is widely present in the common environment, it can be easily weaponized. And you will recall in the US at a time that anthrax spores were sent by mail to people, and it caused up to 5 deaths and 17 almost fatal infections. So whether we like it or not, anthrax is a disease that we really need to be taking a very good look at. What is even of most importance to us as public health physicians, as public health professionals, because talking about the One Health concept, this is found in the common domestic farm animals, the cattle, the cows, the goats, the sheep. And we had, up until recently, a very robust immunization campaign for agriculturalists and farmers to keep these animals immunized against this disease. The fact that anthrax has emerged means that this campaign has broken down. And that, of course, is deeply worrying to any public health person. So while it occurs naturally in the wild amongst unvaccinated domestic animals, the domesticated animals are the ones that we are likely to come in contact with. And that therein lies the danger. So these are the things that we need to look out for. There's no recorded, and Dr. Oshun can correct me if I'm wrong, there really is no recorded person-to-person contact. But the people who are affected have had contact with domestic animals. And the danger is that within a family, if one person has had contact with domestic animals, other members of the family probably have to.
Wow. So something that we really have to think about and
Yes.
people need to know about.
Yes, people really do need to know about.
Wow. Now, there's so much to talk about, but we won't talk about it practically. Now, in terms of, where the anthrax is anthrax definitely here in Lagos?
Oh,
Is it here
definitely,
now?
yes. It is definitely here in Lagos. In fact, the moment they picked up that case in Niger State, we knew that it was going to be literally hours later that they will pick up a case in Lagos, because the fact of the matter is that that case was picked up because somebody, people had a high index of suspicion and it was detected and it was picked up. But the point is that how many other cattle, goats, sheep had it and had been transported to Lagos is the end market for anything agricultural in Nigeria. So if it is found anywhere in Nigeria, you can be sure.
How many animals have died now?
And how many animals have died exactly that they would have slaughtered for meat to sell? We are living in a very tough economy, so they are not going to burn or cremate any dead animal, sick or dead animal. No, it's going to be slaughtered and sold.
Yeah, that's a worry.
That is a
Because
worry.
people are eating everywhere. And if an animal is ailing now, and they're killing it and selling it to us, I mean, how are we supposed to know where to eat?
Well,
people eat every day at Mama Bashira around the corner. Who's serving us? What are they supposed to do?
Well, the point is that everybody, I keep saying this thing, Dr. Pamela, that we need to, at the end of the day, everybody needs to take responsibility for his or her own health. And you have to be certain of your sources of food for your family, for your children. So I advise people, and this was even since the days of Ebola, I advise people, look, where are you getting your food from? Because if it's fruit or vegetables, it's really, wherever you buy it from, you will bring it home, you will wash it before you cook it and consume it. But, things like meat, where even the washing or the cooking may not necessarily kill the spores, you want to be sure that that meat is coming from a registered abattoir, where there are veterinary surgeons who have checked the quality of the animal before allowing it into the abattoir to be killed. Not the one that you will just see one vendor selling meat on his head and selling it at half the normal price, and you think, fantastic, I've got a bargain. Let me grab this one and buy for my family. These are things we have to think about.
That's why the message needs to go to these people who sell meat, the butchers, the meat sellers, the abattoir workers, to identify, to be able to have high index of suspicion. When there's a sick animal, they must not kill a sick animal. Now, we need to educate them.
This is what we need.
Because they are the ones killing the animal. We are not the ones killing the animal.
I know, this is what we do.
They need to educate. Sorry, we need to educate. That's the Ministry of Agriculture, the veterinarians. We need to educate these workers.
Which we do.
Make sure they
kill. If you go into the market, you will notice you will notice that they are registered butchers associations. You will notice that they are, yes.
It is those who kill sick animals.
Let me land now, Dr. Oshun.
They have very close contact with these animals.
Let me land. When you go into the market, you will find that there are registered butchers associations. And those registered butchers, they know where they are getting the meat from. They have been registered, they are licensed to sell. Invariably, you find that they have a fixed price for the meat. But then what then happens is that after the day is done, maybe getting to like that 5, 6 o'clock, when you'll find that the unregistered vendors now come out. Where they got their meat from, there are no more officials in the market. The markets are very, very regulated places. Even what you think is your Jankara market is a very regulated place. The Iyaloja, the Babaloja, they know they're registered butchers. But what then happens is that people want to buy cheap products. The problem with the cheap products is that may be the sick or ailing or dead animal being killed and sold. It didn't come from a registered abattoir. It's not being sold by a registered butcher. Go into any of the Lagos markets, the registered butchers have to wear a white lab coat. Did you notice that? Or you don't go to market. Ask Yawo, she will tell you. But their
Wow.
meat is regulated, and their meat, I mean, the price of meat has gone up in the last 5, 6, 7 weeks. The meat almost doubled in price. But because that is the price of buying meat that is coming from a registered abattoir, it's been checked, they know it's a healthy animal, then you will always have, what do you call them? Charlatans in the system.
So how do we reach them? To educate them?
It's not them that I need to educate. I need to educate people buying the meat. I need to educate, because ultimately it is you and I that buys the meat. If you buy cheap meat, these are the dangers that you face. If you go to a registered butcher, or better still, if you can afford it, go into a supermarket, because they have to be licensed, they are NAFDAC registered. Go into a supermarket, you will pay more. You will definitely pay more, but at least you'll be sure that what you are buying is safe, and safe for your family to consume. And families that have young children need to be particularly careful about their source of where they buy food. And then this habit we have, where we think that we are saving time. We want to buy, all the food vendors will now be very cross with me, I know, but please, people have to be
Don't
very,
worry,
very
just
careful.
speak. Just speak, please.
Yeah,
for
people
our
have to be
sake.
very, very careful about where they buy their food. Ultimately, it's me and you. I want to educate the me and you who actually buy the food to be
All right,
careful
so-
where you buy your food from.
Now,
So
this is
the
critical.
most important prevention really is vaccination. So apart from health education for the
Now,
workers,
who gets vaccinated?
the animals.
The animals must be vaccinated.
And,
Okay, so can I
know
just
that
give an example? If, for
started.
example, I have a little farm, or at least maybe in my yard, I have maybe 3 goats, 2 chickens, how do I get my goats vaccinated? I don't want them to come and get sick and die. They can get the anthrax, can't they?
Yes, they
How do you
can.
regulate people like myself who have just a few animals? We're not a proper,
Now you are being responsible and accountable to your animals. You don't want your animals to get sick. You don't want your animals to die. You don't want to eat infected food. You go to your nearest primary healthcare center. There are environmental health officers there. They are in the best position to advise you where to get where to either take your animals, or better still, get the veterinary surgeons to come in and vaccinate your animals. So before you even start that whole thing of, I want to keep a goat or a chicken or 2, you have to make sure that you've got these systems in place, so that you are registered, so to speak, with a vet clinic, a responsible vet surgeon who can come in periodically every year, make sure your animals are properly immunized.
Now, I must say that this all sounds good. And if, for example, I was to have 2 or 3 goats or whatever, I know I would do that. But sometimes, you're just going down the road. Like, for example, there's a place where my church is, and there are just some random goats wandering about the place. I don't even know who owns them. How do we know if one of them isn't getting the
Then
anthrax and coming
please
to come near us
don't
now?
kill. Those are the ones. Don't feel that, corn don't land, and you now grab the goat because you look left, you look right, it looks as if there's no owner of the goat, and you grab the goat and take it home to go and kill and make a soup. Don't do that. Don't do that. If at all you are going to even try and get away with that, make sure that you have your best friend who is a vet surgeon on speed dial to quickly come and give that animal a once over. But that is the whole point of what we're saying. In fact, that was our biggest problem. I don't want to digress, but that was our biggest problem with avian flu. We didn't know where all these birds and fowl were coming from. But you see, this is the thing. Invariably, number one, I can assure you that as far as Lagos is concerned, there's no goat walking the road that does not have owner. So please, but the most important thing is, if you are not sure of the provenance of that goat or sheep or cattle or cow or animal, please, when in doubt,
Okay,
do
so
not.
I think we've heard the message of that. Now, I need to understand the issue about why they're saying people should not eat pomo. I mean, pomo is an essential part of all our foods. Pomo
Exactly.
is in ofada,
In fact,
ayamashe, foriro, you name it. How
I
do
know.
you tell people don't
I
eat
I
pomo?
personally rebelled when that directive came out, until I spoke to a veterinary surgeon, and he made it. I mean, Dr. Oshun is there. He's the microbiology expert amongst us. He made it perfectly clear. He said the hides and skins are where the spores are most commonly found. You don't forget the Bacillus anthracis is found in the soil and whatnot. These animals, that's their normal environment. So invariably, there's a very even if the animal is healthy, the chances are you are going to find the Bacillus anthracis and the spores on the hides and skins. And the way they are processed for pomo, the processing does not take away or does not destroy the spores. That is the problem. So the people handling it are most likely to be infected and be able to pass that infection on. And then, of course, you who buy, invariably you take it home. And you remember you asked that question, how many people boil that pomo for 2-3 hours to be sure that every last spore is killed? In fact, it'll make the food quite tasteless if you were to do that. So that is the reason why he said, not that pomo in itself is bad, although it has very little nutritive value, but be sure of your source. That is the message. That is the message we need to pass on. Be sure of the source of your food, pomo inclusive.
Dr. Oshun, anything to add to this?
I think it's also to add that the disease the spread from humans to human is negligible. So the spread is mainly from animal to man. So it's a good one. That's the spread of the infection from human to human is not efficient. So the disease is mainly spread from animals to man. I would also implore those who are in charge of the abattoirs, who are in charge of the butchers, to make sure that they do not kill sick animals. That's very important, because if those who are killing the animals or who rear the animals or who keep the animals don't kill sick animals, then it's not likely it will get to the market for us to buy or eat. Because I would not be looking for animal to touch. It's the one that will buy in the market that will come in contact. So it's very important to do that, and also to teach them how to clean and disinfect the area, and for them to know who to report to. That's very important. We all say Ministry of Agriculture to report to the veterinary, but those who don't know, how do they get in touch with the authorities to ensure that they can report when they find a sick animal?
Now,
the best place to report to is the primary healthcare center. The environmental health officers in the PHC are the best people to report to.
Okay. Now, for people who are listening and saying, you know what, I don't know where I get my food from, I eat from, Sikira around the corner from at the back of work, and I'm not feeling well. What are the symptoms, human symptoms, that people should look into or report if they think they've been affected or infected by anthrax, and where should they go?
Okay, so if they think they've come in close contact and they have symptoms like I mentioned earlier, if it is the skin anthrax, then they would have a sore on the skin with a black center. They may have fever. If it's the one that affects the abdomen or the stomach, then they could present with diarrhea, vomiting, abdominal pain, and fever. And if it's the inhalational anthrax, the one in which that affects the lungs, then they would have cough, difficulty with breathing, fever. And so if they have these symptoms, especially when they know they had contact, then they should report at the nearest health facility.
And I think very important is they need to report the fact that they've been in contact with animals. Yes. So unfortunately, our time is fast spent.
Animal.
Do you have any last words for our listeners, Dr. Oshun?
Yes. The last one will just be that the approach to anthrax is multidisciplinary. So we call it the One Health approach, involving the environment, the veterinarians, that's those who take care of animals, and of course humans. And so we all need to work together to ensure that this disease is brought under control.
Dr. Alero?
Mine will be to us, the people. We, the people, need to take collective responsibility for our health. So please hold the people where you get your food accountable. Ask questions. Don't be shy. If you are not sure of the source of the food, it is cheaper in the long run not to buy and to go to a place where you can be sure of the source of your food, your meat, your everything, so that you don't just use your money to buy sickness for yourself.
Thank you. Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.